Hello, I just wanted to give you a quick update trying to set the stage for our first day. So when we're looking at this, we're looking at June 17th. You're supposed to be looking at the shoulder complex, the scapulothoracic musculature, the glenohumeral musculature, the AC joint, and the SC joint. So let's take a look at that on primal. So here's primal pictures at the moment. We're looking at the actual scapula here. We add a layer, and we're now we'll want to learn the attachments, both proximal and distal, as well as the nerve supply and the actions of these muscles. So the first muscle in question then would be rhomboid minor, rhomboid major, levator scapula, and serratus anterior. You're probably wondering, why is this fool just clicking on stuff? The reason I'm clicking on this is it's up to you guys to make those flashcards. It's up to you to get those flashcards written, and let's talk about your flashcards. So for instance, as an example, serratus anterior. There's a whole lot of writing here. What do you think is important to you as a physical therapist? Well, it's a series of slips from lateral aspect of the upper 8 ribs, so ribs 1 through 8, and the fascia associated with them. It also has an interdigitation with the external oblique muscle of the abdomen. So if I was writing a flashcard, I would say serratus anterior proximal attachment would be the upper 8th ribs, or ribs 1 through 8, the fascia of the ribs, and the external oblique muscle. Its distal attachment is on the costal surface of the scapula, and that is all you need to know. The nerve supply will be the long thoracic nerve, C5, C6, and C7, and its action, of course, is to protract and laterally rotate the scapula. That's what you're going to put on your flashcards. This is the levator scapula. You see that's a little bit less writing, a little bit easier. You're going to want to know that it attaches to the transverse process of the upper 3 or 4 cervical vertebrae. Why am I not being specific? Because in certain cases, you have patients who will have only go to C1, C2, and C3. In other cases, it goes all down to C4. This is an anomaly. Normal, you want to know both the third and the fourth because it can vary in your patients. Okay? And then, of course, the medial border of the scapula between the superior angle of the spine, opposite to the supraspinous fossa. A lot of verbiage, whereas the superior medial angle is right there. That's what you really need to know. Superior medial angle. Okay? We'll try and make it easy for you. We go up some levels. We've added some skeleton to that. We roll to the front, and we are now faced with the omohyoid. We add more muscle layer by clicking on the up arrow. Pectoralis minor, you're going to want to know its proximal and distal attachments and its nerve supply and its action. You'll also notice that the lats have now, and the lats are a very important muscle because they stabilize the shoulder during pitching. They also are an important extensor, but you're going to want to know all of this. A lot of verbiage here. What do you need to know? The spines and supraspinous ligaments of the lower 6 thoracic vertebrae and all of the lumbar and sacral vertebrae. It also attaches to the posterior iliac crest and the lower 3 or 4 ribs. It also attaches to the small slip to the inferior angle of the scapula. So on our cadavers, you're going to note there's a little slip here. This looks like it's not there, but in cases there's actually a slip here. So far, we're 5 out of 5 of them all have it. We're now looking at the upper trap, and of course you're going to need to know about that. And we are now faced with the pectoralis major. Pectoralis major has a clavicular portion and a sternocostal portion. Make sure you split those up and know both of their attachments, proximal and their distal attachments. We are now looking at the rotator cuff itself. This muscle here is the teres minor. This is the teres major. You're going to want to know both. Supraspinatus here. We add a layer, and of course that's going to be the infraspinatus right there. We go up a little bit more. Here comes the lats again. Continuing on with the rotator cuff, this is the subscapularis muscle. This is the long head of the biceps. You should know the long head of the biceps as it relates to the shoulder because of its proximal attachment, which is within the joint capsule of the shoulder on the superior glenoid rim, on the superior glenoid tubercle. Subclavius is not a rotator cuff muscle, but you should know it because of its attachment and stabilization activities in the shoulder. We've now added the coracobrachialis to this picture, the short head of the biceps. Structurally, you're going to want to be able to identify the superior medial border, inferior medial border of the scapula, coracoid process, the acromion process, infraspinatus fossa, supraspinatus fossa. You'll want to be able to identify all of the osseous structures of the humerus. Very simple slide, very, very helpful, however, because it gives you a lot of bony landmarks. Also gives you the axillary pouch of the inferior glenohumeral ligament, because this is the posterior side. This would be the posterior band of the inferior glenohumeral ligament. This would be the axillary pouch of the inferior glenohumeral ligament. Axillary pouch, this structure is actually the anterior band of the inferior glenohumeral ligament. This is the middle glenohumeral ligament. This is the superior glenohumeral ligament. You'll want to know all of these AC ligaments, perhaps also a helpful view. You're noticing that I'm over here on these slides and on the skeletal ligaments of the shoulder anterior aspect. So ways that you can utilize Primal to really make your life easy, because you can still click on these structures so that you can fill out your flashcards, because you're going to want to be familiar with the coracoacromial ligament and the trapezoid and the conoid ligaments. I can click on it. There it is, conoid ligament and the clavicle. Here's a close-up of the AC joint. This is actually depicting an AC separation type 3, helpful for you. And don't forget the deltoid. We have a middle, anterior, and posterior deltoid. You're going to want to be familiar with that, and you've got various ways of clicking on it and finding out the information from